Let's start the bullet trend revision of the previous topic and the PYQs. What we have to focus for our upper limb. Can you see the FMG July 2023? Now focus, focus, focus. Deformity as shown in image, X-ray was observed. Which nerve? I told you nerve. Nerve is important. Can you tell me what is this? Sir, this is our, yes, wrist drop. Comment. Yes, sir, this is the wrist drop. Thank you, Brijman. Thank you. Okay. Our South Indian heroes will also come at the screen. Don't worry. Just wait and call your all the friends for this session. Yes. Can you see? The fracture will be asked. Sir, there is the fracture of the shaft. Which part, beta? Upper part. So this is nothing. This is your which nerve? Answer is the radial nerve. One question sure from ortho, your radio and anatomy integration. Can you see the next question? A person came to the OPD with history of the fall on the outstretched hand, got injured. I'm just telling you the PYQs, na? Description theory after this, na? Anatomical snub box. What I want to tell you, anatomical snub box. This question earlier had been asked in INICT, then NEET PG, and now FMG exams continuously 3 times. So in the anatomical snub box, yes, extend the thumb. I'm coming close to you. Yes. What I want to tell you, extend the thumb. At the base of the thumb, there is a one depression. Just like the Gabbar Singh, you know, Gabbar Singh was using the khani and this way. And then, yes, in the similar way, there is a drug abusing mechanism. Put the drug abusing substance at this base of the thumb, rub it, and then, maja aa gaya. What you have to remember, sir, it is in the anatomy. That's anatomical. It is used for the snuffing. That's a snuff. It is box-like structure. That's why box. Short, because 5 clinical are related here. That's why. Okay, sir. So at this base, there is the scaphoid bone. Answer will be the scaphoid bone. Okay. Share the knowledge, everyone. Whatever you are knowing, share together. नालंदा विश्वविद्यालय हमारे भारत देश का बहुत बड़ा विश्वविद्यालय था, लेकिन बेटा नॉलेज जब तक आप शेयर नहीं करोगे तबाह हो जाओगे. ये मत सोचो कि नॉलेज शेयर करूंगा तो सामने वाला ज्यादा जान जाएगा. नो, इफ यू विल शेयर द नॉलेज, the most benefit, the maximum benefit to you subconsciously. Okay. Now, can you see the FMG July 2023? This question came from the your NEET PG exam. Can you see? There is a bulge on the our front of the forearm. You know the Popeye the sailor man. Yes, he was having the bulge after eating the spinach in America to motivate the children to eat the spinach. Okay. दे इंट्रोड्यूस वन कैरेक्टर पॉपॉय, एक बहुत ही फेमस कार्टून कैरेक्टर था जो कि पालक की भाजी खाता था और उसके पास बॉडी आ जाती थी. सो जस्ट लाइक अपीयरेंस. सो व्हेनेवर देयर इज द रप्चर ऑफ द बाइसेप्स, व्हेनेवर देयर इज द रप्चर ऑफ द बाइसेप्स, इन दैट सिचुएशन, सर, देयर इज द आवर bulging. This is nothing, sir. This is the our Popeye sign, biceps rupture. Now come to this next. This is the another question. There was the image. This is the orthopedics. You all know the carrying angle. But when the hand is getting deviated outer side, so this is the cubitus valgus. Answer is the ulnar nerve damage. But remember, there is the, I will teach you the median nerve damage, supracondylar fracture, which will result in the cubitus varus. Okay, sir. So we have to learn this cubitus varus valgus. Now, what we have to study? FMG January 2023. Again, they are asking the nerve. Means upper limb. You have to study the learn. So this is the medial epicondyle. Just behind the medial epicondyle, which nerve? Sir, ulnar nerve is the answer. Yes, there is a funny sensation behind the medial epicondyle. That's why humerus is known as the funny bone. Why? Just due to this, our ulnar nerve. Agree, beta? Getting the point? Okay, sir. Now look for this, our next session. Yes, anatomical snub box. I will teach you. Entire 10 minutes we will discuss about the anatomical snub box. So in the anatomical snub box, there is the anterior boundary and the posterior boundary. I taught you during the regular class. Anterior longus, posterior longus, between is brevis. Yes, anteriorly, when this muscle will contract, it will cause abduction of the thumb. So that is our abductor pollicis longus. Yes, when this posterior arrow part will contract, it will cause extension of the thumb. So this is your extensor pollicis longus, and between is brevis. I will tell you later, but it is clear, sir. It is our extensor pollicis longus. Means one question short from the anatomical snub box or its clinical point. I will teach you the 5 clinical here. Okay. Now look for the action. No need to mug up. I told you the concept. You given the 1 hour for the general basic concept. Can you see? Without identifying this activity, muscle. Sir, this muscle is coming from the above. It is crossing from the above and then lateral. Jidhar muscle, udhar movement. This muscle is above. This muscle is laterally. So when this muscle will contract, it will cause above and lateral movement. Sir, this is the abduction. Yes, away from the midline abduction towards the midline adduction. So this is causing the abduction at the shoulder. Okay, now look here. There is a one controversial question. June FMG 2022. A patient comes to the OPD with chief complaint of the pain and swelling in the shoulder. A fracture of the clavicle is suspected, which is the most common site of the fracture. So there is a Drishyam movie. What happens? We are aware from our orthopedics. We are aware from the orthopedics that there is the clavicle. Alman classification. Sir, there is a medial 1/3, lateral 1/3. Sir, the middle 1/3, 80%. Sir, lateral 1/3, 15%, and sir, medial 1/3, yes, 5%. Remember beta, the drawback of the PYQs. PYQs, they are must, लेकिन बेटा उसके घाटा भी होता है. When we are doing the PYQs, there is a Drishyam movie. What is the Drishyam movie? Yes, 2 जून को पणजी गए थे, सत्संग में पाव भाजी खाए थे और वहां से हम वापस आ गए थे. यस, विजय और उसकी फैमिली इतनी बार इन चीजों को कहती है कि सब लोग ये मान लेते हैं, लेकिन एक्चुअली ऐसा नहीं हुआ था. When we are doing the PYQ again and again, at that time in exam, yes, when this question will be asked, it happened in the June FMG 2022, and all students mark this answer, medial 1/3. No. The medial 1/3, sir, medial 1/3 is 5%. But due to the Drishyam, due to the rapid, again and again, looking for your PYQs, you will see that medial 1/3 as the middle 1/3. Okay? So read every line, every point, every comma carefully. You all know the famous dialogue from our GRG, sir. Okay? So focus for that. It is not the middle 1/3 given in the option. It is the medial 1/3. Okay, so if it is not given, in that situation you have to opt the junction of the medial 2/3 and lateral 1/3, because this junction, it is lying near the middle 1/3 part. Agree beta? Okay, now remember, this is the very easy question, no excuse. Can you tell me what is the situation? Elevation. This is, sir, our winging of what? Sir, scapula. Sir, this is our winging of scapula. Got the point? Okay, so this is done due to paralysis of the which muscle? Answer is the serratus anterior. So I will teach you the muscle and their nerve supply in clinical. Yes, very good, Prakash, very good. Now can you see? Again, FMG 2020, shaft of the humerus was noted, and there is the line, inability to extend his wrist. Inability to extend the wrist means this condition. This is the wrist drop. FMG 2020. They are asking the same question. This is our bullet train discussion and analysis. They are asking the same question. Wrist drop and the shaft fracture in little different twisting way with the orthopedics and the radiology. Yes, answer was the radial nerve. 2023. Beautiful analysis. Yes, sir. This is your FMG 2020. Same question, little different way. Answer is again radial nerve. Agree, everyone? Same things are asked in your INICT NEET PG with little more twisting, na? Okay, sir. So, can you observe again? They are asking leprosy treatment. This is your community medicine PSM conceptual brainstorming integration. Yes, in case of the leprosy, Mycobacterium leprae, it is involving the skin, depigmentation, sweat gland damage, yes, hair follicle loss, and then they are penetrating deeper side and they are involving the nerve. Which nerve? Most common nerve, ulnar nerve, and ulnar nerve will cause the ulnar claw hand. I will teach you. Getting the point? Also, it can involve common peroneal nerve in the leg. Another very important MCQ from the NEET PG 2019. Sir, great auricular nerve. 3 nerves. What I want to tell you, sir, ulnar nerve, sir, common peroneal nerve, and sir, great auricular nerve. Don't forget this great auricular nerve. It is related with the shaving area, angle of the mandible. It is related with the phrase syndrome, auriculotemporal nerve syndrome, root value C2, C3, 5 MCQs. Yes, till now we had covered 23 MCQs, approximately 23, 24. Many important lines I told you, na? Agree, sir.